Okay, so what do you get out of this experience? So far, it's probably sounded pretty daunting and intimidating, but the beauty is you will get much out of this clinic. You are about to experience the incredible rewards of your selection of OHSU General Internal Medicine. The first is you are going to experience an incredible diversity of patients. You will also be taking care of patients who most need you. And you will, through this process, grow both personally and professionally. First, the diversity. No other place is like this. You will be taking care of the rich and the poor, back to back, a few minutes apart. You will be taking care of your colleagues and employees. You will be seeing physicians, executives, and professionals, as well as patients coming here from across Oregon to see you to get a second opinion. You will also be taking care of folks in your community, and that includes your neighbors next door as well as people living on the streets here in Portland. You will see new immigrants who have truly just arrived within the past few weeks, and you will be seeing the whole spectrum of age, young, old, and everything in between. Now, combine that with the fact that these are patients who need you. They are, for the most part, the sickest of the sick. You will see a sprinkling of healthy folks, but day in and day out, this is a practice that's about hardcore internal medicine. You will also be seeing the patients that no one else in the community wants to see, folks with Medicaid, Medicare, and no insurance. How are you now going to make the most of this? This is a pretty challenging group of folks, but it is one that will provide you with great rewards. But it won't happen on its own. I've just found through experience here that you probably need a game plan for growing within this practice. And I believe legitimately there are many ways to approach this. I'm proposing one way that I've found personally helpful and I've seen work with other residents in this practice. And that's an approach that's based on values. And by values I mean, I'm going to put forth here a few guideposts that I think you can and should turn to when things aren't going well, and when you're trying to think about how to work through challenging times in clinic. I'm going to show you now 3 simple values that I hope can guide your experience here in clinic. And the main point here is that these values should provide you with some touchstones during the course of your day, both in clinic and in the hospital, on which you can rely upon. The first one is the most important. You are here to care, and this is a profession about caring. So, at the end of the day, no matter how you feel, you're really here to care for people who, for the most part, feel pretty bad. And I think if you can remember that, you will at least have a foundation on which to go forward. Next, you're here to learn. This is your education, and it's actually fairly short. It's a few months. You're here 36 months, 3 years, and you have a lot to learn. And I think if you can come into practice every week with the intention of learning as much as possible, you will be better off for it. And finally, you're here to serve. You are an employee here in the hospital and in the practice, and there's plenty of caring and learning to do, but you're also here to serve the patients who are in front of you and help the practice grow and take care of people. Those are the 3 values I come back to pretty much every day when I am here: caring, learning, and serving. But even with those 3 values, you have to put them within a framework. And I just ask myself, and I hope you're asking yourself, what is your plan here? What is your plan for personal growth? I propose that you have a few goals. The first is, in clinic, you should be here to expand your medical knowledge and skills. That's probably the easy one. That's going to happen almost on its own. Obviously, the more you can put into it, the more you will grow. But that's certainly one of the aspects. You're here to learn internal medicine, both the knowledge and the skills. The other goal, which may not be as obvious, is that you're here to gain self-knowledge. I think that's probably the most important one and the hardest one to achieve. I think that the more you can learn about yourself and how you care for people and how you learn, the more you will get out of this practice. Because the medical skills will be all around you. You are here taking care of the most complex diagnoses and having the most complex medical management cases. The self-knowledge, though, is a deeper issue. It's about how you think, how you act, and what values you bring into the room at each visit, and a self-realization of what your weaknesses are and how you will work around those, and how you can eventually become the most effective and masterful doctor around. I think those should be your goals, and you will be confronted with how to deal with your own self in this practice. So by taking the values and trying to put them into action in this practice, I believe that you will make the most of this clinic. We do expect you to embrace the patients here and establish relationships and even give up of yourself to make the most of this practice. And finally, we're asking you to embrace your responsibility. You are the point person for these patients. You are their physician, and you have the responsibility of taking care of them. You are providing the follow-up, you are arranging the care, and you maintain their records. It is a big responsibility with big rewards. And finally, I think it's important that you acknowledge your own weaknesses here. You do have a knowledge base that is still growing, and the more you can put into that growth, the better off we'll all be. You have skill gaps that you will be filling every week, and you have gaps in insight that will slowly be filled through your time here in practice. But the beauty is watching it happen over 3 years. And at the end of 3 years, I am certain that you will be among the top physicians in the country. You will be also among the most mature of physicians because of the experience you've had in this practice. You will develop really the tools of being a masterful actor who can pull on various techniques to get the job done. And you will have the confidence that you can handle pretty much any type of patient who you will see in the ambulatory setting, because in the end you will be a master of yourself, and that really is the goal of being in clinic. So with that, have a great 3 years here at OHSU. I think you will find it to be an amazing experience. Best of luck.